Inspiration 92.3 FM, your number one family radio. Good evening to you and welcome to Sharing Life Issues. It is the Wednesday edition. Now, if you know me, normally on Wednesdays, we talk about health issues, but we've not been carrying on with that for some weeks because Dr. Dumebi disparud.
Wow.
No, that's not the truth. That's not how to say it.
Wow.
Dr. Dumebi had been away.
I went on leave.
Okay, she went on leave.
Yes, I went on leave, and the thing is, Chiomabbb, you had to expose me to the people of God.
No, okay, so Dr. Dumebi was away and she couldn't help it. It wasn't a case that could be helped. She had to go on leave.
I had to rest.
Yes,
I've been working tirelessly, and I needed a break before I break down.
See?
So,
and everybody gets a break. Why shouldn't you?
Absolutely.
Exactly.
But the good news is I'm back.
Okay.
I'm refreshed.
Yay.
I have extra energy for the people of God and their myths concerning their health care. I think we were discussing one right before the show started. And it's just, I don't want to say the name because it's going to derail our discussion for today.
We're not doing it.
But the thing is, I'm happy to be back. I've missed you all terribly. And I feel like we have so much to talk about when it comes to our health. So
yes,
let's just jump right in.
Okay, so Dr. Dumebi Mordi is her name. In case you joined us recently and you haven't spoken with Dr. Dumebi before on the show. I should also mention that the first half of the show is brought to you by MTN. Shout out to everyone who's tuned in via the radio 92.3 FM. Welcome. Thank you for joining us at the website www.ifm923.com. Welcome and thank you for joining us. And of course, on Instagram Live, my people, Chiomabbb is the handle. You can join us right now. Watch me making faces and other things. I can't mention all your names right now because I can't see them from the distance and I didn't kind of open them on time. But thank you for joining us. Someone starts by saying Dumebi, don't go.
Wow, this song lives another year.
So today we're talking about what to do when there are emergencies.
Yeah, in emergency situations.
In emergency situations.
Right.
Question though, why are we talking about this?
Because I've had many experiences with people having an emergency situation in public, and most of the people around them have no idea, no clue what to do, right? And I'm thinking about a most recent situation where a lady was having a seizure down the street from my office, and I was the closest healthcare professional, so they came to get me. And so basically this lady was having an epileptic fit, a seizure. She has a history of epilepsy, and all the people around her didn't know what to do. So I think one of them just thought, just run down the street and I get that lady. So they literally dragged me by my arm. I was sitting in my office and they ran in, panicked. I was like, what's going on? They said the lady is shaking, she's seizing, she's foaming at the mouth. What do we do? So I said, okay, fine, take me to her. And the man just literally grabbed my arm and was dragging me down the road, but it's okay. we do it for the love of humanity, right? So he dragged me down the street. We get to the place. It was like maybe 3 or 4 doors down from my office, and we ran up the stairs. So this young lady, I think she was about 21, 22, she was on the floor and she was convulsing, right? Convulsing, aka seizing, that kind of jerking movement. She's shaking uncontrollably. She has lost consciousness. She was foaming at mouth. She had a little bit of saliva coming out of her mouth that was foamy, and her younger brother was with her, and he was so panicked because I couldn't
do anything as well.
Yes, I mean everybody there was panicked because they just basically thought, we don't even know what to do with this lady. Do we carry her? Do we leave her on the floor? Do we figure it out? Some people are done, Nollywood style, they put their hands on top of their head and start shouting, making noise, which is completely useless, by the way. They did that, and then I got there just in time to stop the young man from shoving a spoon in her
I was
mouth.
going to say, yes, somebody would have thought about that because you see that they put spoon and put palm oil.
Palm oil, what's that going to do?
Well, I don't know. I just know that I've seen.
We have to, like I said, once again, Nigerians creative in the wrong direction.
Nigerians.
I'm in Nigeria now. That's why I can talk with family, right? Listen, creative in the wrong direction. What does palm oil do? Please, what does palm oil do? It makes you feel better that you've tried something.
It's just maybe it stops the whatever happens.
No, it doesn't do anything. It's a waste of time. Matter of fact, you shouldn't put any liquid in the
person's
mouth of somebody who's actively
choke.
Absolutely.
Okay, so this is a very good reason for us to talk about issues like this, and we are talking about what to do in case of emergency.
Right.
While you're there.
Right.
You are not a healthcare practitioner, yes, but there's some. Wait.
There's some quick things.
Wait. Excuse me. I think I want to ask the question.
Yes.
When you were in primary school, secondary school, did they teach you any first aid treatment? And I'm asking we Nigerians.
Right.
Did they take you through
in primary school
or secondary school?
No.
Like, why don't we have that?
That's an excellent question, because we can save a lot of lives.
Yes.
Right.
First aid, basic first aid, what to do, resuscitation.
Before you can get them to a hospital or a healthcare practitioner. That makes a lot of sense. I think it would save a lot of lives, especially there's some emergency situations that the faster you act, the better the outcome at the end.
Mm-hmm.
So what we're doing is a series of discussions. We'll talk about some key emergency situations, right? What you can do while you are waiting for a healthcare professional to get to you, right? And what you cannot do. Things you should not do. Like, number one, in this case of the lady who was having a seizure,
don't put spoon in
under no circumstances should you put any object in the person's mouth, much less a spoon. Because the thing about seizures is the person has uncontrolled movement. So you that you're trying to jam a spoon in the person's mouth, you can cause injury to the person. 2, the person can chomp down on the spoon or chomp down on your finger or your hand.
Yeah, people put their hands in the person's mouth.
No, never, ever. Don't put anything in the person's mouth. Don't even put liquid or water or tea or palm oil. Don't put anything in the person's mouth. The first thing you need to do is, if the person is seizing and is standing in front of you, when I say seizing, I'm saying convulsing, shaking, doing those jerky movements that are associated with epilepsy. First thing you need to do is try to get the person to lie down. Lay them down gently. Don't run and push the person on the ground. Don't do that. Lay the person gently as gently as you can on the floor, right? Or on a firm surface. The floor is fine. Try to see if you can put something soft around their neck, like a pillow, like maybe a rolled up t-shirt. Maybe take off your shirt, roll it up a bit, put it under their neck to support their neck.
Why not under the head?
What do you mean under the?
So off the top of my head,
right?
If you put it under the head, you're trying to make sure that they're not shaking too much and hitting their head.
No, you don't want. You want to support the neck because you don't want the neck movement, because part of your how do I explain it? You want to protect like the spinal cord. Okay. So just sit the thing right under the neck, just as a support. If you can't get to the person, the person is jerking so fast, just lay them quietly on the floor, gently. Remove any hard objects around
them, like
chair, table, anything that is hard that they can, in the process of jerking, they can hit it and damage themselves. So clear all those things around. If the person has like a tie, like maybe it's a man that was wearing a shirt,
loosen the tie,
remove the tie if you can. Loosen the top button so the person is free
to breathe.
Yes.
And probably the belt.
Yes, if they have a belt you can do that, but it's not a real concern, the belt per se. If maybe the person had passed out or just collapsed and wasn't having a fit, yes, you should loosen the belt. Okay,
so let's calm down for a bit. Let's take a quick commercial break. When we come back from this quick information by MTN, we'll be back to talk about this all over again. We're talking about some of the things you can do in case of emergency, the quick fixes until the medical practitioner comes or until you rush that person to a hospital.
Right.
And when we come back, we'll also open the phone lines to talk to you. We'll be right back.
Yaba, one seat, Yaba.
Sweet granuts, buy your granuts, buy your sweet granuts.
Granot. How much for one konko?
100 naira.
Oh yeah, give me 100 naira on. Add 888 join.
Customer, you sure say you fit finish this 888? Now 5 konko be that too.
But if I no finish I get people for house wey go shop wetin remain.
Okay, 1 konko, 2 konko, 3 konko.
Oga, no be 100 naira groundnut you wan buy. Why she dey pack am plenty like this?
Na because of the 888.
Which one be 888?
You no know. 888 na the code for 5 times better awoof. Yes, so MTN awoof don come again. Now, when you recharge with star 888 star pin hash, MTN go sama you with 5 times your recharge. You fit also enjoy this awoof on top VTU. Just ask your vendor for awoof for you. This offer na for both MTN prepaid and postpaid customers. Wait, add 888 now.
It is Sharing Life Issues brought to you, and this first half of the show is brought to you by MTN. My name is Chiomabbb. Yes, I didn't introduce myself at the beginning because Dr. Dumebi Mordi is in the studio. We're very happy to have her back.
I'm happy to be back, Chom.
Oh, someone sent me a message that I should have read even before the show. Someone sent a message to say thank you. Yes. Hi there. I once called your program where you had a guest speaker, doctor, she was talking about breast cancer. I called and told you that I had this pain under my armpit and there was this ominous silence. Your guest told me to see a doctor, which I did, and I found out lots of lumps in my breast.
Wow.
Thank God it was discovered that what I had was hormonal imbalance and I've been on medication for it.
Okay.
Then she said, please, can you invite the doctor again?
Oh,
Doc is here.
I'm honored. I'm glad you got the help you need.
Thank you. Okay, so we're talking about what to do in case of emergency, how to deal with someone in case of emergency, and we started out talking about when somebody has seizures.
Yes.
We talked about some of the things you can try to do when the person has a seizure.
Yeah.
One thing you mentioned is loosing whatever it is that's holding especially their throat.
Yeah. If it's a man, right, or somebody that's wearing a collared shirt that's buttoned up with a tie, loosen it up, remove the tie, open up the top button. If it's a woman and they don't have anything that's restricting their neck, that's fine, just leave them be. The important thing is to lay the person on the floor, right, or on a firm surface,
and then fold something, protect their neck.
Yeah, protect their neck. If you want to go the extra mile, protect the head, it wouldn't hurt. The important thing is when this person is jerking and moving around, you just need to keep them in an area where it's soft, there's no hard objects around. Clear the area, clear the space around the person so they can kind of move freely, because you can't control the movements at that point, and neither can that person, right? So another thing that would be important to note is that when the person is lying down, don't lie them on their back.
Don't lie them flat on their back.
Don't lie them flat on their back. Lie them on their side, either the left side or the right side.
Why?
Because sometimes they may be foaming at the mouth, right? And stuff is coming out of the mouth. You can allow whatever it is that's in their mouth to just come out. Don't put any object, and definitely no spoons, no palm oil, no liquids of any kind.
No fingers.
Don't put your finger, because the person can chomp down and bite you. So that's the worst possible thing you should do, because I think we have like an old wives' tale that's floating around, and people seem to think that putting the spoon in the mouth will stop them from swallowing their own tongue. It is not.
Yes, that was what I heard. Yeah, swallowing their own tongue. What's up with that?
You yourself, go to the mirror, stick out your tongue. Is your tongue suspended? Or meaning your tongue is held in place, right? Your tongue doesn't just randomly start moving to the point where it can go back in your throat and you will swallow it. It's not possible.
Okay, so Soti 2K says, nice topic. It's good to educate us on this because a lot of people don't know what to do in case of seizures or epilepsy crisis.
Right.
Thank you very much.
Yeah.
We're going to talk about as many cases as possible.
Right.
But you can also call in and talk to us about maybe emergencies that you have seen or heard about and you were helpless or you couldn't do anything.
That would really be good.
Yes. Someone says, thank you for the talk on seizures. What do you do afterwards when you have calmed the person down?
Okay.
I have a case of someone who does not make loud noises during seizures and can do that about 4 times as if he will die. Okay. Brain was tested and nothing like injury was found. He's of age.
Okay.
It happens to the person almost 2 months until
carbamazepine is a drug.
Okay, was found. Now about 4 months it happened again. This is according to Tunde. So what would you say to that?
Okay, so a couple of things. What this question has like so many layers to it. So the first thing is, you will not be the one to calm the person down when they've had a seizure or they're having a seizure. You pretty much just let them lay there, like I said, on their side, support their neck, remove hard objects from around, loosen up their clothing, and just let the seizure run its course. The normal seizures usually last about 30 seconds to 2 minutes.
Okay,
so on average, it's a very, very quick thing. I know it's very alarming and it can be very shocking to observe. However, it's over very quickly. Now, if the seizure goes beyond 5 minutes, it's an emergency situation, like the person is continuously seizing for 5 minutes or more, then you need to make arrangements to take the person to the closest hospital.
But question: if it normally spans between 30 seconds and 2 minutes, shouldn't I be concerned by the third minute? Why do I have to wait till 5 minutes?
Those are the standards. I think on average 30 seconds to 2 minutes, but some people's seizures can go longer,
up to 5 minutes,
especially people who've had history of epilepsy, and or there's some other things that can cause somebody to seize, like maybe they've had trauma to the head, maybe they have a fever, a sudden spike in their fever. There's some drugs that can cause people to seize, and a myriad of other situations. So if the person has a history of seizures, or all of a sudden they're seizing, right, I would say the first thing you need to do is let the person calm down. Literally, just don't put a spoon, don't do anything, let them calm down. And then if the seizure, you timed it and it was beyond 5 minutes, then the next step is take the person to the hospital. If the person was injured in the process of seizing, like the story I told earlier, the brother was trying to shove a spoon down her mouth, and I got there and I knocked the spoon out of his hand because he wasn't listening. He was so scared at that point because he wasn't hearing me. But in his process of trying to jam that spoon in his sister's mouth, he damaged her lips, he cut her lips, and he cut like the roof of her mouth, so she was bleeding. So so when we got there, her face was covered in blood, her shirt was covered in blood, so we didn't know what the source of the bleeding was, so she definitely had to go to the hospital, right? If the person has multiple seizures, we named that time that you've been timing the seizure, like it wasn't just one continuous one. They seized, they stopped, they calmed down, then another one started, then they calmed down, then another one started, then you definitely need to go to the hospital. Okay. If the person inhaled water, like again, maybe somebody was feeling like maybe they should put water in their mouth, or palm oil, or inhale the liquid, you definitely need to take the person to the hospital. And if the person has no history of seizure, just randomly out of the blue just had a full-blown seizure, you need to take them to the hospital so they can determine what the source or what the cause of the seizure
was.
Right?
So you've mentioned a few things. I'm going to take a quick break again, but you mentioned a few things I want to highlight. I think one of them would be the fact that seizures are not always epilepsy.
Yes.
They're sometimes caused by, you mentioned medication, sometimes it's a head trauma, and sometimes it's epilepsy, could be something else.
Yes.
So you don't know what the cause is, so do not go and give them follow the old wives' tales when you don't know what the cause is. I want to take this call. I need you to answer. Hello, good evening.
Good evening.
Good evening. Who am I speaking with?
Yeah. You're speaking with Eric. I don't know.
Okay, hi Eric. Please just give me your question in 30 seconds so I can take a break.
Okay. So I really wanted to confirm if something can trigger this. So I had one of my cousins who was just like us. He never had any seizure. But after a while, he kept having this seizure every now and then. Mm-hmm. So a medical doctor who came from Germany called us then when we were still kids, like 13 years. And then they confirmed something. Anytime he takes anything that is slimy, from the history, he tried to note it, to trace backward, and we discovered that was it.
Every time he takes something that is what?
Anything slimy, okra, ogbono, snail, fruits that are slimy, anything at all.
He just starts to have a seizure.
Yes, so since then, over 5 years now, we noticed it. He has never had it. So
okay.
Don't take anything slimy.
Wow, this is interesting. Thank you very much, Eric. We're going to take that quick break now, but to you, a quick break from our sponsors, MTN. We'll be right back to take your respond to that call and, of course, take other messages.
Them talk say I wolf the run belle, but today I don't see the one where they run out. Are you getting me? Now you go get MTN I wolf for you, where they give people 5 times any recharge from 100 naira and above. Once you recharge with star 888 star pin hash, you get. Now be say if you recharge 100 naira, you go get 500 naira. If you recharge 1000 naira, now 5000 naira be that oh. You dey feel me so? And you use a calling network. No more go to G say you don't get credit. With MTN I wolf for you, your G's go just the flow everywhere. It makes sense, abi? Just dial star 888 star pin hash to enjoy this awoof. This offer now for both MTN prepaid and postpaid customers. You fit also enjoy them for on top VTU. Just ask your vendor for awoof for you. Are you getting me?
It is sharing life issues on Inspiration 92.3 FM. Of course, it's the Health Wednesday edition. Dr. Dumebi. Before we went on that break, someone called in and said his cousin used to have didn't have epilepsy when they were born, but over time just suddenly started having random seizures.
Right.
And he said a German doctor told them that if he takes anything slimy, okra, snail, anything, whether it's a fruit or food that is slimy, it's what causes his seizures. He wants you to affirm or deny.
I don't know currently of any foods that cause seizures. Period. And then I did a quick search to see if other people know of foods that cause seizures, and I'm unable to come up with anything. So I'm not really sure about this correlation between slimy food and seizures. I don't have any evidence to support it. But since the German doctor in this message had confirmed and done some sort of investigation to confirm that the slimy foods is what's causing seizure in this person, then they should just avoid the slimy foods. However, I am very skeptical about that comment, to be honest with you. I don't think it's I would like to see the evidence to support it. So
okay,
I've never heard of foods that cause seizures. So I've never seen it, I've never heard of it, I've never read it anywhere. I did a quick search, didn't see anything either to support it.
Don't worry, she didn't search regular Google, she searched experts.
So for me, I think it's a bit I'm skeptical about the comment, to be honest.
The number to call 0700-923-923 0700-923-923. On WhatsApp is 0817-313-6193. If you get through to us, turn down the volume of your radio. Hello, good evening.
Good evening, Chairman. Good evening, Dr. Dumebi.
Peter from Apapa. Good evening.
Good evening.
All right, welcome back, Doctor.
Thank you.
That's the issue of seizure and convulsion, where they say they put spoon in people's mouths. I want to tell you why people say so. Though it's fake news.
Yes.
When we're in secondary school, they say when people convulse, that's what the information we got, that if their upper teeth and lower set of teeth combine together and grind against each other, that the person might die. When they are convulsing, when they are opening their mouth, they quickly look for a spoon or anything to put in their mouth.
No.
It will happen in a place, maybe at home, where their moms, they are not near the kitchen where they can get spoon. So in a bit to save their child, in quotes, they will start all their 4 fingers in their mouth, and their child will now bite off almost all their 4 fingers, and they will hail the mothers that they did well for being heroic.
Oh.
So, of course, tell the listeners that there's nothing like that. Or is it true, Dr. Dumebi? I want to ask.
Thank you for that question, Peter. And I want to reiterate to everybody, please, and please, there is no value in buying into some of these old-fashioned ideas when we know better. Because right now, the era that we're in, we're surrounded by a plethora of knowledge. Any topic you want to know about, I guarantee you somebody has written it, somebody has put it on the internet, right? And if you don't believe the things I'm telling you, that's fine. Go and research it for yourself. Unanimously across the board, healthcare professionals agree that putting a spoon or a finger or all 4 fingers in the mouth of someone who is seizing is a bad idea. Okay, so to use Peter's example where he was saying the fear is that you don't want the top teeth to touch the bottom teeth, right? But if you now put a spoon in metal object, it's even worse. It's like, imagine you put a spoon in your mouth and you bite down hard on it.
I feel like that's like,
you will knock out 1 or 2 teeth.
There's energy, static energy that you're even.
I don't even understand static energy, but the force by which, because keep in mind, the seizure is like a bunch of uncontrolled movements of your limbs, your arms, and if someone chomps down, right, on a spoon, you will potentially cause injury to the person and yourself. So don't put anything in their mouth, please. Whoever started that rumor is fake news. Let's stop doing it, please.
Hello, good evening.
Hello, good evening.
Good evening. Please turn down the radio for me. Turn down the volume of your radio.
Okay, I have.
All right. So what's your name, please?
My name is Jane.
Jane.
Yes, please.
Thank you for calling. Go right ahead.
Okay, well, I had a brother that was having a seizure. How it happened, one day he came to visit me, and all of a sudden we saw him passing out. We didn't know what it was. But when we got to the hospital, we later found out that he had meningitis that is in the nose.
Yeah.
So, but, okay, after he was treated, we noticed it always comes back, though he was on drugs. So my question is, will he finally go, or is this something he has to suffer for the rest of his life?
It's hard to tell. It's hard to tell, but meningitis is one of those things that causes seizures. So, like I said, okay, so let me just clarify the difference between seizures and epilepsy.
Do you have any question for her? Because I want to let her go.
Oh, how long has he been having the seizures, and when did his meningitis happen?
Okay, it happened a couple of years ago. Though they told us that the drugs they gave him, I don't know the particular name, that he has to take it for like 3 years, and then after that, but though he's not had it in like 6 to 7 months, so we're just, we're always scared because he's a bachelor, he lives a lot, so we're always scared. We hope he doesn't come, anytime.
Yeah.
So we're hoping and praying that he's totally cured. But could there be triggers, or can somebody that has once suffered such, be fully recovered?
Okay, that's a good question. So the thing is, has he finished his course of treatment?
Yes.
He has finished it. Okay, and so there's a couple of things he can
I'm going to let you go now, ma'am.
Okay, thank you.
But I'll answer the question. So there are a couple of things he can do. There's some diets that they put people who are prone to having seizures on, right? So that way it can kind of minimize the risk of the seizure. That's one. Number two, the triggering incident here is the meningitis, right? Mm-hmm. And now that one has been cured, ideally the seizure should stop, right? And it shouldn't come back. However, there's no telling what has happened in the interim. People who've knocked their head, had some sort of blow or trauma to the head, maybe, especially, remember I said, separate them from any hard objects. Imagine if someone was seizing and convulsing, seizing in front of you, all of a sudden they just fell to the ground and they knocked their head on the ground.
Head trauma, yeah.
That could be a challenge as well. So there's multiple things that they can do. And then if he's having recurrent seizures, right, outside of the meningitis being cured and done and dusted, they need to go back and see if there's any other underlying cause that they may have missed. Once they figure out the cause of it, because obviously it's not a state of normalcy, once they figure out the cause of it, they can now figure out how to treat it. So I don't think she should be concerned about sentencing this guy to a life of recurrent seizures, because the difference between seizures and epilepsy is when you have recurrent seizures over and over again. But if you have like an underlying disease state, like maybe meningitis, or you had a trauma to the head, a big massive blow to the head, or a stroke, or some unknown origin, right, you address the cause of the seizures, you make the seizures minimize, or you stop them altogether. Is what I'm saying making sense?
Yes.
Yeah, so there are options.
Don't know the extent to which the meningitis itself.
No, the meningitis should have been cured by now. It doesn't take 3 years to cure
it's the trauma that might have happened during one of those seizures.
Yeah, I mean, I'm just speculating because I don't know this man's history. So I think the first thing to do would be, one, the meningitis has been cured, right? Mm-hmm. You finished your treatment, no more seizures. I think what she was communicating is this something that can happen again in the future?
Yeah.
If it does happen again, then it's worth going back to the hospital for them to run some tests and figure out what is the cause this time so we can address it. But don't panic and think this is something he's doomed to deal with for the rest of his life.
Okay, as that question is answered, I do need to take one more break, and when I come back from that break, I want to take some more of your calls. So give me a minute, I will be right back.
They say things are tough. They say succeeding here is difficult. What they say may be true, but together we will be challenged by it. Because we all know the truth is based on what you see, and what we see is the hunger for success. The defiant promise to never go back, no matter what. And when we stumble, we will only fall forward. Fueled by the prayers of our loved ones, the hopes of 200 million people, and the big yellow heart pumping energy into us to break boundaries. So let them continue to tell you their truth while we take time to write ours. There is more within. Turn it up.
It is still sharing life issues. It's Health Wednesday, and today we are talking with Dr. Dumebi about emergencies and what to do when there is a health emergency. Today we're focusing on seizures. Don't worry, if we can't finish this conversation today, we can always take it to next week and talk about something else in, what to do during emergencies. But before the break, we answered the lady's questions absolutely, right?
Yes.
Okay. I want to take a call and then go back to the young man's question that he asked before. Hello, good evening.
Yeah, hello, good evening.
Good evening. Who are we speaking with?
Kelvin from First Town.
Thank you for calling, Mr. Kelvin. Please go ahead with your question.
Yes, I used to have a sister.
Just speak up a little, please. We're trying to hear you.
Yeah, I used to have a sister.
Okay.
Who usually has seizures. But when it happens, we let her be. And my grandma then doesn't do anything about it. She just lets her be. And after some while, it cools off and we live on. But that's just by the way. But there is a question I want to ask. Not really a seizure kind of thing, but whenever I take in food, like very hungry and I just take in food, maybe the first 2 spoons I feel dizzy. I don't know why.
Okay. Do you have questions for him?
I mean,
you get really hungry before you take in this
because I'm just there's so many questions. There's so many things floating through my head. So okay, I will say this. It depends on. I'm not really sure how long you wait in between meals.
Yeah.
If you're somebody who is one of those people that you're hungry but you still press on, for several hours to the point where you start feeling faint and weak and things like that, that could be a sign of low blood sugar. I'm not really sure what to do, what the first couple of spoons have to do with you feeling dizzy. I would suggest, and when you say dizzy, you mean like you're about to faint?
Yes, but not that very serious.
Just a little lightheaded then.
So if you're lightheaded, I would suggest that you don't allow too much time in between your meals, right? It could be just a sign of hypoglycemia, which means your blood sugar is low, which means you've probably waited too long to eat. So break your meals up. If you're somebody who eats like once a day or twice a day, try to eat like several small meals throughout the day to just kind of keep feeding yourself, as opposed to waiting till the end of the day to eat a very massive meal.
Okay.
All right, that helps.
Thank you very much.
You're most welcome, Kelvin.
Okay, so good evening. I think I will go back to that guy's the one that sent us the first question, because I don't think we answered all the questions, and now we're going to have to hurry through.
Yeah.
Thank you for the talk. What do you do afterwards?
Yeah, we talked about that. After you've calmed the person down, when to go to the hospital.
And right? You said if the person in 5 minutes they're still having seizures.
If it's more than 5 minutes, if they've had recurrent seizures within that time, meaning several seizures, it wasn't just one continuous one, right? If the person was injured during the seizure, if the person inhaled water or any liquid, or if the person has no history of seizures, take them to the hospital afterwards. But if the person has been diagnosed as an epileptic, or there's something going on with the person and they had that seizure, then just calm the person down, just help the person, just calm down. Don't, when I say calm them down, don't try to restrain them, just let them be, like the last caller said.
That's it?
Yep.
Okay.
And it says, I have a case of someone who makes loud noises during seizures, can do that about 4 times as if he will die. Brain was tested, no injury was found. He's aged. It happened to the person for almost 2 months until carbamazepine was found. That's a drug for seizures that's found in his bloodstream. And now about 4 months ago, it happened again. So if carbamazepine was found in that person's bloodstream, that means they probably were started on medicines for the seizures, and probably their levels were too low. So that person needs to go back to the doctor that started them on that drug and see if they need to adjust the dose.
Okay. I hope we answered the question now. Someone says, hello, welcome back, Dr. Dumebi. Good to have you back. Trust me, we missed you. Nice topic. But I want to ask, is epilepsy a communicable disease?
It's not a communicable disease or an infectious disease. You can't catch it by hanging around somebody else.
Secondly, what triggers it?
Like we said, there are many causes, right? It could be trauma to the brain, like I said. And I guess, I want to take that back. I think he's saying the multiple seizures or having seizures, right? Is it communicable? No. By touching somebody who has had a seizure or who has epilepsy, you cannot contract it.
Is it hereditary?
I don't think it has a strong genetic component. No, I think it's one of those things where some people have it, some people don't. Some people, maybe in the course of their lives, they were knocked on the head with
too many times.
Yeah, no, well, not knocked like how we punish children, which we should stop doing, by the way. That's not very good. But I'm saying like you hit your head on the ground very hard.
Okay.
Or you hit your head on a wall very hard, or maybe you're in a car accident, something really major. It can trigger seizures. And then what else can, like a disease, like meningitis, like we talked about,
Yeah.
or feverish kind of situation, like a sudden spike in your fever. Maybe you had an infection,
Okay.
and it affected your brain. It can cause that as well.
All right. Let's take another call now. Hello. Good evening.
Yeah, good evening, ma.
Good evening, ma. Who am I speaking with?
Yes, I'm Mrs. Odi from Agro Palace, ma.
Mrs. Odi.
Yes.
Okay, Mrs. Obi, go ahead.
I have a little baby. She started her when she was 1 year old. Now she's 4 and she continues. I don't know.
Sorry, Mrs. Obi, can you take that again? I can't totally hear you.
Like I said, yeah, the sickness started when she was a year old, and she's already 4 now. And if you think things like that, that whenever she's having high fever, then the next thing returns to convulsion. So I don't know if there's a medicine for it.
So what I would suggest is, number one, talk to the pediatrician, right, and explain this. That I would imagine that the pediatrician has a history on her and understands that she's been having the seizures. Have you talked to your doctor about it?
Ma?
Did you explain to the baby's doctor that she's been having this history of seizures when she has a high fever?
Yeah, whenever she's having high fever, very high.
Does the doctor know? Did you tell the doctor about this?
I'm not hearing you well.
Did you tell your doctor? Have you told the
Pediatrician.
doctor about it?
We normally take her to pharmacies because it's usually midnight. Normally.
Okay. So you have to take her, even after it has come down, you have to take her to a hospital so that she can see a pediatrician. That's the children's doctor, so that they can know what to do.
Okay, so let's take a step back. The first thing is, if you know it's the fever that is triggering it, right? The minute she starts feeling warm, okay, give her, I don't want to give you a specific drug on air, but you know what you normally give her, that children's syrup with a particular drug in it. You know the one I'm talking about.
Okay, ma. Maybe I should cut it so I can hear clearly, ma.
Okay.
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 I don't want to recommend.
No, that's fine.
But she knows what she normally. Yes, there's a fever drug, very popular, very common, that we give children. Yeah. Okay. So the minute she starts feeling warm, don't wait for it to rise too rapidly. Give her the drug immediately, and then take her to the hospital, because you don't want to wait too long on that.
Okay. Hello. Good evening. Hello. Hello. Good evening. Turn down the radio. Okay, call me back. I want to take messages.
Yes, please.
Okay, I think I'm done with this one. I think I'm done with that one. Hi, good evening. Nice topic. My son did have convulsion caused by excess bleeding after circumcision. The boy is now 4 years, and we have tried to monitor him when we discovered some jerking when sleeping. That has stopped now. But what we have now discovered is that he gnashes his teeth while asleep, and you can pretty much hear the sound from a distance. Please, Dr. Dumebi, what advice do you have for me?
I think that what he can do is talk to a dentist. They have mouth guards for people who grind their teeth in their sleep. Something that they can, I think, is like a little plastic cover for the top teeth and the bottom teeth. You put it in there when the child is going to bed. So even if they grind their teeth, they won't chomp down too hard.
Why does that happen now?
It happens to some people. Stress causes it, to be honest. Some people, it's just a habit they picked up, where maybe when they're sleeping they bite down hard. So it's a very relatively simple solution. Dentists are able to give you some mouth guard.
Mouth guard.
Yeah, a mouth guard is kind of like it's like a cap you put on the top of your teeth and the bottom. So it's like it protects your teeth. So when you are grinding down, you won't grind down too hard.
Okay.
Yeah.
Thank you, Dr. Dumebi. Good evening. My neighbor's son just died now of convulsions. Instead of them taking the child to the hospital, they called a traditional man to cut the child and apply some what I don't know on the child. Then the child died. Please, I'm anonymous for now.
Okay, thank you for that comment. First, I need to clarify, you cannot die from convulsions. Okay?
Interesting.
Because what probably killed the child is I don't know what they applied to the cut. I've never heard of that being a treatment. Don't even know where they cut the child. Don't know if the child was bleeding. But you definitely, that's not the appropriate way to handle it. So I'm not a fan of that. No offense to people who believe in the traditional medicine, but there are some things that you need to go where someone who knows how to manage this can handle it, right? Cutting the child and applying something obviously did not help in this situation. So I guess we should all use this as a warning that, you know, some things are beyond our kind of traditional ways of handling things. Take the child straight to a hospital and let them handle it. If it meets some of the criteria I told you about, person sees for more than 5 minutes, maybe there's a fever involved, right? Or this rapid kind of spike in body temperature. Person had multiple seizures back to back, right? Maybe the boy hit his head. A closed kind of head injury, right? So maybe bleeding internally. There could be many reasons, but going there to cut somebody and apply something that you don't even know what the name of it is usually a recipe for
disaster.
Yeah, to avoid stories that touch, just go to the hospital, please.
32 cases, please. I want to know if having seizures will ever stop completely for someone who has epilepsy.
You can there are many there are treatment modalities, meaning there are ways in which they can treat it. So seizures are classified based on the parts of the brain that it occurs in,
okay,
right? And depending on the duration of the treatment of the seizure, right, and depending on the underlying cause. So if the person has been diagnosed with epilepsy, there, like I mentioned, there is a diet that they put them on to reduce the number of seizures. There are drugs that they put them on to ensure that the person stays seizure free for an extended period of time. I think the key thing is to take a step-by-step approach to it. You can control it to the point where I do know people that, you know, were patients of mine for a while, that by the time they got their drug therapy so well down to, you know, the nitty-gritty, the person pretty much went the rest of their lives without seizures. Yeah.
Please, doctor was going to give us the difference between epilepsy and seizure.
Thank you very much. Epilepsy is the actual disease, the diagnosis. So for somebody who's had like recurrent seizures, 2 or more recurrent seizures, right, they may be diagnosed with epilepsy. A seizure can just be a one-time thing, right? Depending on what's causing it, can be a one-time thing, happens very quickly. It can be very dramatic in nature, but the person will just, you know, kind of pass through it and you never have another issue with it. Or it could be in the case of the lady who mentioned her brother with the meningitis, right? He could have had the meningitis. That was what then caused the seizure. They address the meningitis, the seizure stop, right? Okay. But if you have a situation where none of these factors are at play, you didn't hit your head, you don't have closed head injury, you don't have meningitis, there wasn't a stroke, there wasn't any illness that was tied to this thing, and you have these recurrent seizures, the doctor may diagnose you as having epilepsy. So epilepsy is the disease, and let's think of seizures as like the symptom.
Okay.
Does that make sense?
Okay. I hope that answers your question, Eric. Thank you. Okay. Wow, this was long. It says, good evening, greetings to the doctor. I know someone who started having seizures in his early 20s. He had an episode while or after eating a particular kind of food, swallow meals. Sometimes he has full-blown seizures, other times absence seizures. This had more to do with the psychology because his mind had registered such meals as a trigger.
Really?
A doctor described the situation as fixation. He was treated for some years with some medication I will not call, and the seizures stopped. This is Onyebuchi from Lagos.
Yeah. So I'm not really sure what Onyebuchi's question.
I think he just wanted to share a situation.
No, thank you. I appreciate that. I think that, like I said, if the person's drug therapy is well optimized, right, and they've taken their time to see, you know, check the blood levels, make sure the patient is compliant. Some of these people go the rest of their lives without having another seizure. Yeah.
Okay, let's take this call. Hello. Okay, let's do this again, people. We know the drill. When you get through, turn down the volume of your radio, because if you're doing feedback, we'll spend that time trying to hear you. Then we'll now cut because we did not hear you. You now did not say what you wanted to say. Time have go. It's true. Hello, good evening.
Good evening.
Good evening. Who are we speaking with?
Ada, calling from Takondi.
Thank you for calling, Ada. Go ahead with your question.
Okay, please, I want to ask, what could cause a child like fainting? My daughter went to school one day and later they called that she fainted, like she was on the queue, trying to wait to wash her hands. The
Okay.
next thing is just
So let me ask you, Ma. Your child that was on the queue waiting to wash her hands, was she in the heat? She was outside?
yes.
Okay, she was probably sweating.
Spot.
Yeah, so there's a few things that can cause someone to faint.
I'm going to hang up now, Ada. Do you have a question for her again?
No, I'm
Okay.
just going to give
Keep
a
listening.
general answer. So there's a few things that can cause someone to faint, right? It could be overheating or dehydration in this child's case. It could be low blood sugar. It could be a blow to the head or the chest. It could be due to heart problems. It could be due to low blood pressure. I mean, it's many things that can cause someone to pass out or faint.
But if it's happened only once, should I be concerned?
I think the first question would have to be to figure out what the circumstances were surrounding when the person fainted, right? If maybe, like I said, this young girl was out there waiting to wash her hands, so she's probably outside in the heat. The sun was probably
With a
beating
bunch
her.
of people, was crowded.
Yeah, and small children, when they go to school, we probably bundle them up in a bunch of things, shirts, socks, skirts, belts, all those things, and maybe just proved to be a bit too much for her, so she was too hot, she passed out. It happens. I think that if you figure out that that's what triggered it, then it shouldn't be an issue if you prevent it from happening in the future.
Okay, messages. Chema, good evening. I have often watched women apply scent leaf efirin with palm kernel oil mixed together to the nose of a convulsing child. Does the smell produced by the mixture have anything to do with the healing?
No, not to my knowledge. No. I mean, this is another one of those things where people do things that they think will work, but I don't really have any scientific basis for that, so no.
Okay. This one says, what's the difference between convulsion and epilepsy?
We talked about that already.
That's seizure.
Okay, seizure
That was
versus
seizure and epilepsy.
Okay, so seizure is convulsion is a type of seizure.
Okay.
Right. So a convulsion could be in a situation where you don't have epilepsy, right? Maybe a drop in blood sugar, right? Maybe the person hasn't eaten in a while, right? Maybe a fever, like rapid increase in the body temperature, right?
Mm-hmm.
Tetanus can cause a convulsion, right? Sometimes seizures tend to be due to epilepsy, but can be due to other factors as well, right? So sometimes I think epilepsy is more of like a chronic neurological disorder, and it has to be actually diagnosed. You can't just wake up and say the person has epilepsy. Someone has to actually go through a process by which they get a medical history, and then they come up with a reasonable suspicion that this was going on with the person. I would say epilepsy is more about having multiple seizures as opposed to just a one-time kind of thing due to an underlying cause. Does that make any sense?
I think so.
Oh, you think so?
I think so. Hello, good evening.
Wow.
Good evening, Chioma.
Hi, good evening. Who am I speaking with?
Okay, my name is Nne.
Nne, thank you for calling, Nne. Talk to us.
Yeah, I just called in to share a personal experience.
Okay.
My daughter actually had seizure at some point. The first time it happened, we were actually on our way to school in the morning, and she was sleeping in the car. Before I knew what was happening, she had seizure.
Wow.
Someone talked about having to put your fingers in your child's mouth. You know, as a mother sitting beside a child,
Yeah.
and you're seeing that happen to a child sleeping.
Yes.
I didn't know when I put my fingers into her mouth.
I understand.
Eventually, she calmed down, and she said, "I was fine. And then we went to the hospital.
Yes.
Now, at the hospital, they said, okay, she needs to see a pediatrician. And just as we're getting to see a pediatrician, in the 2 days after, she had the same seizure again.
Wow.
And by this time, the pediatrician that saw her immediately put her on some drugs and said the very first day she would have been on this drug. And then the guy started investigating to say, did she fall down as a baby? To go and do some brain scan. So I brought the brain scan, and he said, look, there are some spikes showing here. It's either this child didn't cry at childbirth, or she fell down as a child and she had an injury. And, he was, trying to find out that. And I remember that as a child, she fell from my laps because I was tired and I slept off. So I remember that pain, that day that she fell. So he put her on that treatment. She was on that treatment it never happened again. She was on that treatment for 3 good years. So we're taking the drug morning and night.
Yeah.
And eventually they started weaning her off the medication. It was now once a day. It was now once in 2 weeks until it cleared off.
Mm-hmm.
So my advice to people will be, once these things like this happen, we shouldn't go the traditional way. We shouldn't use our brains. We should go to the hospital and seek the right counsel. That's it from me.
Yes.
Thank you so much.
Thank you, madam.
Thank you for sharing.
I appreciate you sharing your story.
Thank you.
For everybody that's listening, please, I know it's very scary when you see a loved one having a seizure in front of you, but please don't put your fingers in there.
And don't just stare at them either.
Well, I mean, just clear the space around them, right? Make sure the child, like, you can lay the child flat on, lay the child on her side, right? And just allow the seizure to run its course. Lay the child on her side, allow the seizure to run its course. Don't put your finger in the mouth, don't put anything in the mouth, and then take them straight to the hospital, please.
Okay, so just before we go, Irene from Ikoto sent a message. She says, "Good evening, Chairman and Dr. Dumebi. Please, I want to know if it's true. When a baby falls with his head many times, can this cause seizure or epilepsy?"
Yes, like you see the previous caller just kind of made my point for me. So head trauma, when I say head trauma, I mean a heavy massive blow to the head.
So whether it was hit on the head or the person fell and
because it's not a wise choice. I don't think that your hand, when you knock a child on the head, is strong enough to do that, but just in case, let's not do it, right? Number two, I'm talking about things like you fall down, you're holding a baby, the baby falls and hits the head on the ground. Or maybe or the baby maybe was running around and ran straight into the wall and knocked their head on the wall. Those things are important to pay attention to, and as soon as it happens, I would take the person to a pediatrician, let them check out the baby and make sure that everything is okay. So yes, it is possible it can cause it. Can cause a seizure, yes.
So today we are taking time to talk about what to do in case of emergency. Well, in particular, in case of a seizure or an epilepsy emergency.
Yes.
We've talked very, earnestly about that, so you now know some of the things not to do. The one thing I would tell you don't carry your phone and start videoing the person. That's not the issue.
Exactly.
Don't be staring at them. That's not, again, the issue. You want to watch them die? If you don't put them, because no, when I said if you want to watch them die, because if they're in the wrong position, and they're swallowing they're choking on their own saliva because they're not on the side like you mentioned, they can actually die from that.
So the thing is, she can choke from swallowing saliva, right? But the important thing is this: it's not for you to stand and put your hand on your head and do nothing. The things you can do are very simple but very effective, right? The first thing you can do is, if you're panicked, just move all the tables, the chairs, give the child or the adult space,
support their neck,
so they can and then put like something soft under their head or their neck, if you on their neck, under their neck, or under their head if you wish, to just protect them. If you cannot successfully do it, leave them alone, but the important thing is they should lie on their side. So even if there's something coming out of the mouth, it will fall naturally to the ground.
Social media handle, how can you be reached?
At Dr_Dumebi DUMEBI_Mordi MORDI on Twitter and Instagram.
Dr_Dumebi _Mordi. At Chiomabbb is the handle. At IFM 92.3 is our social media handle, Instagram as well. God bless you. Stay out of trouble. Bye bye.